Bismillahirrahmanirrahim. Our lecture is about verbal and telephone orders. Someone else is using this one now. Can you mute yourself? Okay, it's near now. Can you hear my sound? Anyone using? Okay. So today our lecture is about verbal and telephone orders. This is part of our Sabahi preparation, corrective action plan, and we have a lot of updates related to the verbal and telephone orders. So it is supposed to be implemented starting from now. I have shared one Google form for the attendance. So please mark your attendance also there. So what are the verbal orders? A medication order from an authorized prescriber, which is received by an authorized licensed practitioner using an appropriate read-back procedure that is subsequently recorded in the patient's chart and countersigned by the prescriber within a time period required by the institution. And telephone orders are communicated verbally through telephone to a licensed individual who is authorized to receive and execute the order. This policy is shared between PC21, MM23, and QM25. The first update here is that previously the physicians were only allowed to prescribe, but inshallah in 2023 we will have dentistry department, so we have already updated to included the dentists in the licensed prescribers. This will be now physicians and dentists. Another update is that previously this was shared between the three departments, and quality department was the owner of this policy. But now this policy, it is responsibility of the Pharmaceutical Care Services Administration and Pharmacy and Therapeutic Committee to review, update, and monitor the implementation of this policy for effective compliance. So pharmacy department will be the one responsible for the updatation, review, and implementation. We know that verbal and telephone orders are only accepted in following situations: when you are providing an emergency care and a physician is not free in hand to provide this order, so he will give a verbal order, or he's involved in performing an intervention or a procedure, or a prescription is not readily available inside the hospital, so he can give a telephone order situation. The update is that we have now one exception. It is the cardiopulmonary resuscitation, or the code blue. In this situation, the people in charge who are performing the CPR give a verbal order, and even the nurses, they will not be, they can execute the order without writing down. So this order will be carried out. But once the CPR is finished, immediately after that, the prescriber and the nurses both need to document inside their medical records. Another update, it's very important update, is that 3 people will be allowed to take the verbal and the telephone orders. These are the registered nurse, the registered respiratory therapist, and the registered midwives. Very important update for all the physicians, that the prescriber practitioner must sign the written order, written record of telephone orders within 24 hours. Okay. Whenever you give a telephone order within 24 hours, you have to write down in the patient's medical record. We all know that it's electronic medical record. So wherever you are, just write down your medical record. If, for example, you came for a round and you are in female ward and you have to write down in male ward, no problem. You can write down your telephone orders. Okay. Make sure that verbal orders are written before you leave the unit. Okay, so you give the order, even if your duty has finished, you have to write down your verbal orders, okay, before you leave the unit. Verbal orders are not permitted via text message, voicemail, email, any such things. These are not allowed. So you cannot just give a verbal order by a WhatsApp message or by SMS. You have to speak to the nurse. Okay, you have to speak loudly and the nurse will read back to you so that this order will be executed. Another update, which is part of the medication order again, the inpatient medical prescribed as PRN. Okay, we are always writing PRN medication. These PRN medications should be ordered so that these are available for 24 hours. Okay, usually what we are saying that weekends we will give an order PRN. It will be applicable for only one dose, but physician should make sure that these orders are applicable for at least 24 hours. This is why we are doing this, because of the safety of the patient and continuity of the care. Okay, so this order should include the diagnosis, the frequency, the duration, route of administration, strength, and the dosage form and indication for the PRN order. Okay, it's very important for you to remember that even when you are giving a PRN order, it should be for 24 hours. The licensed midwife or the nurse who received the order or verbal telephone order, these are the people who are included. But for the medication orders, we have excluded, very important thing, the specialty technicians. So technicians working in any department, they will not be allowed to receive, because by laws, it is not their responsibility. Okay, so why we should give them a medication order? Now, related to the documentation, we were practicing only registered nurse, radiologist for the radiology, and blood bank staff for the blood orders. This for emergency situations is still applicable, but we will clarify in our policy that blood radiologist only for the radiology request in emergency, dire emergencies. Okay, and blood bank staff only for the blood orders in dire emergencies, not for routine cases, not for routine emergencies, dire emergencies. Respiratory therapist and the registered nurse, these are updated, midwives are updated. For the nurses, very important. What is read back? Read back is to ensure the safety, verbal and telephone order. A read back verification of complete order back includes, you have to repeat that unless you clearly understand the date and time of order, the generic or the brand name. The nurses, they have the responsibility to ask for the brand name. Okay, they can ask you about exactly what is the name of that medication. If you are saying some medication which is not written in the our list of medication, they can ask you 2 or 3 times just to clarify what is the exact name of that medication. Oh, of course, the drug name, the dosage, duration, route, frequency, age and weight of the patient. Age and weight of the patient, especially for the pediatric, when the nurses, they will check the weight more frequently and adjust the dose accordingly. Very important, PRN, why you are prescribing it as a PRN. Now, how to document? Very important for all the nurses department. They should write down the nurses notes. Okay, now we have electronic medical record, so they have the electronic nurses notes in which they will write down the physician order in this way. VO, verbal order, at the top of their nurses order, write down VO. Under that, write down doctor's name or whoever the clinical staff giving the order, the name of that particular person, ID or the pager number, and title, date, and time. Then you start from the order. Okay, so in the verbal order, as you can see, VO, verbal order, here you will write down the order. For example, injection, Satuline, 1 gram, IV, BID. Okay, then you write down the name of the physician, their pager, title, date, and time. Is it clear? Or I will tell again. This is for the nursing staff, how to document in the nurses room and receive the verbal or the telephone order. So this is for the verbal order, and telephone order you can use TO. All right, so an exclusion, very important exclusion, the telephone orders are not acceptable for controlled medication. So whatever the controlled medication, telephone orders will not be accepted. These include the narcotic medications, high alert medications, and the blood transfusion orders. So telephone, don't give telephone order. Tell someone that give that Fulani narcotic. No, it will not be accepted. In dire emergencies, the verbal order is acceptable for narcotics, high alert medication, and blood transfusion, but the ordering physician must authenticate as soon as the emergency is over or before leaving that unit. Okay. Actually, it should be as soon as the emergency is over. So what are these medications? These are just the sample. Cytotoxic therapeutic drugs, do not DNR, discharge orders, out on pass orders for unstable patients, post-operative orders, pharmacological restraints, patient control analgesia, hyperammonation, heparin order, hypertonic saline. These are some of the medications which are not allowed to be given as a verbal or telephone orders. Okay, it's a simple policy, and thank you very much for listening. I hope it will be implemented. Okay, important thing is that this is just a lecture and this is the start of it. We will be following it, the implementation by regular visits. Okay, this will be by rounds. We will be performing rounds and checking the orders. Okay, we will be following all the OVRs. If any such thing will happen and we receive an OVR for verbal or telephone orders, this will be, of course, we have to take some actions about it. So be careful. From now onwards, there will be a continuous monitoring. Okay, thank you very much.